Treatment presentation by Monique Schulman, occupational therapy student. Meet Alexa. Alexa is a 22-year-old female with a Colles fracture in her right wrist. Her desired occupation is painting her nails. The outcome we are focusing on is participation in her desired occupation and reducing pain while she is painting her nails. The services are being provided at an outpatient clinic where Alexa attends once a week for 45-minute sessions. This will be our fourth session together, 4 weeks after her cast was removed, which is 12 weeks after she initially fractured her right wrist. Frames of references used. During the evaluation and treatment stages, the Canadian Model of Occupational Performance, or CMOP, will be utilized to identify strategies to decrease barriers such as low satisfaction in her emotion regulation and increase supports such as her motivation to resume painting her nails. In addition to the CMOP, the biomechanical frame of reference was used to address Alexa's decreased muscle tone, strength, endurance, and active range of motion in her fingers and wrist. The rehabilitative frame of reference will be used concurrently to modify objects involved to decrease risk of strain and pain as we remediate. Assessments used. The COPAM was used to identify how Alexa perceives her abilities, satisfaction, and what she wants to work on most. Goniometry was used to assess Alexa's range of motion. Manual muscle testing was used to assess strength. The Wong-Baker pain scale was used to assess pain. The Semmes-Weinstein was used to assess touch discrimination. A verbal scale was used to assess her emotional regulation. The Figure 8 method was used to measure her edema, and a task analysis of painting nails independently was done. Intervention approaches. The establish, restore, and modify approaches to intervention guided Alexa's treatment plan in order to increase participation in her desired occupation. The establish approach will establish new skills to improve her emotion regulation, while the restore approach will be taken from the biomechanical frame of reference to address her decreased active range of motion, muscle tone, strength, and endurance in her wrist, hand, and fingers. Concurrently, the modify approach from the rehabilitative frame of reference will be taken to change the objects and activity demands of painting her nails to support her participation while she is healing. Rationale. We will be doing a purposeful activity while using her own nail polish with a built-up grip she added so that she can open and grasp it with less pain. We will have Alexa seated upright in a chair at a table that is at about waist height when she is seated. To prevent edema in her right hand, we will place it on a wedge pillow, and we will put down a plastic tablecloth so it is more acceptable for Alexa to make mistakes with the polish, such as spills and dripping, when transferring the brush from the bottle to her nails. We will also use Alexa's clear nail polish, as she indicated she was worried that she may not finish them in time, which will be less obvious than a color. For purposes of this activity, we will use a color since it is the fourth session with Alexa. Isometric contraction will be utilized to strengthen her abductor muscles and extensors in her forearm, which were weakened as a result of her Colles fracture and subsequent immobilization for 8 weeks. While she is painting her nails, I will observe her for any changes in facial expression, and when her facial expression indicates distress, I will ask her to verbally indicate her zone of regulation on a scale of 1 to 4, with 1 being the most frustrated or angry and 4 being the calmest or least alert. For purposes of this activity, we will use the Wong-Baker pain scale since it is our fourth session together. I will encourage her with verbal cues as she paints each nail, as some struggle is expected with her decreased strength. We will also discuss how Alexa felt during and after the activity and discuss modifications as needed.
We're going to go right this way at this table
seat.
Thank you.
You're welcome. So how are you doing today, Alexa? What's new?
I'm good. Just so stressed. But I'm good.
Okay.
How are you?
Oh, I'm fine. Thanks for asking. So how's the studying for the CPA going?
It's a lot.
Yeah.
Yeah. There's so much to study, and it's like I'll get some stuff, and then I have so much more to study. It's a lot.
Yeah.
Yes.
So we're gonna paint your nails again, but unlike last week where we used the clear polish, we're gonna challenge you a little bit this week and do a color.
Nice.
How do you feel about that?
Very excited.
Yeah, do you feel ready?
Yeah. Ready to try?
Okay, yeah, we'll try it. And we have the clear if it's not working out.
Okay.
Okay, so yeah, just to go over our goals again, we're gonna build some strength in that right hand by doing some isometric contractions when we're holding it down and painting with the left hand like we did last week. And we're also going to, go through the range of motion between coats, and we're also going to elevate your wrist with the wedge pillow again, so as not to let it swell up.
Okay.
Right?
That sounds good.
How does it feel after doing the paraffin wax before?
Good.
Like it feels like a little bit looser?
Yeah. Feels good.
Good, I'm glad. Okay, so let's get started. So I have all of your nail polishes that you brought in the first time. I kept them in our cabinet for you.
So exciting.
Yes, so all your colors are here. So go ahead and pick your color.
I think I'm gonna go with this one.
I like that one. Very good choice. Okay. So do you want to get started using your right hand or your left hand to paint first?
I'll start with my right hand.
Okay, so you want to paint your left hand with the right hand first?
Yeah.
Okay, sounds good. So I'll get this wedge pillow out of the way since we don't need to elevate it when we're using it. Okay.
I think I'm gonna start with my thumb.
Okay, sounds good.
I like this color.
It is really pretty.
I haven't used it in so long, this color. It reminds me of summer.
You're doing a really good job, Alexa. You've come a long way.
It's easier for me to turn this hand.
Uh-huh.
I think later I'll be able to turn my right more, but I feel more comfortable turning my left hand.
That makes sense. Whatever works. We don't want you to feel any pain in doing it. So just let me know if it hurts at all.
Okay. Okay.
Wow.
I feel like I was holding my breath.
So if you had to rate your pain on a scale of 0 to 10, where would you say it is?
1 to 2.
1 to 2?
Yeah.
Okay. Not bad.
Yeah.
Definitely an improvement from last week. That's
Definitely.
good. Okay. So how did the grip feel on your nail polish?
It was a little hard to do. Like it wasn't like before, but it's a little bit hard.
So I think what we should do is we'll do the built-up grip like we talked about. And make that a little bit wider for you so you don't have to push so hard when you're holding the brush. Okay, so here's your new grip. And while you're painting that right hand, I want you to elevate it on this wedge pillow.
Okay.
Okay. Oh.
I got it on my phone.
Oh. It's okay.
It's hard doing things with your left hand.
Spread your fingers far apart as you can. Good. Perfect.
Okay, go ahead and close the lid.
Good. How do you feel about timing painting your left hand?
It's improving a lot, but it's still very slow.
Okay.
Yeah.
How long do you think you need to paint each nail? Like 10 or 20 seconds?
On my left hand, to paint my left hand, I think I could try for 10.
Okay, so let's try 10.
Okay.
You taught me so much about painting nails through this experience. I'm gonna start the timer now, and we're gonna do 10 seconds a nail. Sound good?
Sounds good.
Okay, and go ahead.
Ooh. That one was better.
That was perfect. Do you think you need more time, less time, or this is good?
This is good.
Okay.
This is a good challenge. I don't want to overdo it.
No, I don't want you to overdo it either. Okay, ready, set, go.
It's still fun though.
Okay. Good job.
Okay.
2 more to go.
Okay.
Okay, ready, set, go. Nice. Okay, one more.
Okay.
Ready, set, go. Whoa, nice job.
That was easier on my pinky.
That was really good. Alexa, you did so well. I'm really impressed.
Thank you.
Okay, and so we're gonna paint the other hand and we'll be all done. Sound good?
Sounds good.
Okay, so I'm gonna put that wedge pillow there for you one more time. Okay. There you go. Put the tablecloth on it for you so you don't have to worry about any messes. Good. Okay. Okay. Nice. Okay, before you do the next nail, I just want you to do this. Good. Good. And then spread your fingers all the way apart again.
Okay.
Good. How you feeling? How's the hand doing?
It's okay. It feels okay.
Good.
Yeah. Definitely progress from last week.
Good.
Yeah.
Are you feeling sore at all in your right hand?
A little bit.
Okay. Well, we are working it pretty hard today.
It's not like painful, it's just a little bit sore.
Awesome. All right, so we're gonna let that dry before I take you to the front desk to check out,
Okay.
and then I'll be seeing you in another week. Good luck on your CPA exam. I'm so excited for you.
Thank you.
You've studied really hard.
Thank you.
All right.